Between 3 to 6 million people are diagnosed each year with trichotillomania, a condition in which people uncontrollably pull out their hair. But what causes this condition? And is there a treatment? I'm Dr. Ohad, a cognitive behavioral psychologist here to answer your questions. Let's start with what causes trichotillomania. We know that hair pulling is the result of the need to release tension. But what does that mean exactly? Let's start with what creates tension. Cognitive psychology has proven that negative thinking can cause the release of adrenaline and cortisol into the body. Negative thinking can include judgmental thoughts, criticism, expectations, high demands, perfectionism, or ruminating. By engaging in these types of thinking habits, we increase the stress in our bodies. Next, when we do experience stress, do we know how to tolerate it? A child who is afraid of the dark but is encouraged to sleep in his own bed will eventually learn to tolerate his stress and will gain confidence in the face of his fears. But a child who is afraid of the dark and is allowed to sleep with his parents will learn to heed his fears and not tolerate them. If we don't know how to tolerate stress, we might develop a fear of fear response, resulting in exacerbated stress. So between negative thinking and poor stress tolerance, we've now contributed to a lot of tension in the body. Finally, how proactive are we about releasing all that tension? The point of stress, in all animals, is to push us to action. However, if we don't do anything with all that energy, it can accumulate inside us and eventually push us to automatic behaviors, such as nail biting, nervous tics, skin picking, and hair pulling. Therefore, it's important to consistently engage in behaviors that release tension so as to prevent the buildup of tension that provokes automatic behaviors. Cognitive behavioral therapy, or CBT, has been found to be effective for the treatment of trichotillomania by teaching individuals to adopt healthier thinking habits to promote less stress, to increase their tolerance of stress in order not to exacerbate it, and to be more proactive about releasing tension in order to prevent a buildup that results in automatic behaviors such as hair pulling. If you'd like to learn more about how unhealthy emotional habits promote trichotillomania and how you can stop pulling hair completely on your own, click the link below to visit my free Unhealthy Habits mini course.